Hi, welcome to my channel Nursing Medicine. If you are new to my channel, don't forget to subscribe my channel and press the bell icon if you want to update it with my new videos. Today I'm going to discuss about partograph. So what is partograph? It is a graphical representation of events through which maternal or fetal condition is assessed simultaneously in a single sheet. It's known as a partograph. So here I'm going to discuss about key features in this partograph from top to bottom as follows. So this is the picture or the partograph. That form is itself known as a partograph. So the first section, it's staging with the patient profile, which include name, date of admission, obstetrical score, gestation weeks, consultant names, and so on. That's the first section. The next arrow shows the second section. Below is a recording of fetal heart rate or FHR. In every 30 minutes, mention it by dot and join these by lines. So that's the second part of partograph. The next section, just below the fetal heart rate, it's mentioned about status of the membrane. If it's intact, if the membrane is intact, it denotes capital letter I, and if ruptured, note the color of amniotic fluid. As clear, then we can mention C, and if it is stained with meconium, we are mentioning with the letter M. The next section, the biggest section, that's known as a cervical dilation. So the cervical dilation consists of the dilation in centimeter or descent of the head. So that's a plot X and plot O. In primigravida, cervical dilation in active phase, that means after 3 centimeter, is a rate of 1 centimeter per hour, or in multipara, it's 1.5 centimeter per hour. The average duration of this phase is about 8 hours in primigravida and approximately 4 hours in multipara during an active phase. So that's mentioned in the cervical dilation of the partograph. So next we are going to discuss, just below is a section which mention about the uterine contraction. It's mentioned in squares of vertical column in a 10 minutes interval and fill it according to the intensity of duration of contraction. So like mild, moderate, or severe. We know if it is less than 20 seconds of contraction, it's mild. If it's between 20 to 40 is moderate, and it's above 40 seconds is a severe. Next section which explain about the oxytocin infusion of the pregnant woman, how much oxytocin we have infused. The next section, charting all the drugs and IV fluid which was given for the mom or the pregnant woman. The next section which mentioning about the area for recording maternal pulse rate in every 30 minutes, denoting it by dots, and also it's charting the blood pressure of the mother in every 2 hours. It's mentioned with arrows, and below that we will mentioning the temperature in degrees Celsius as well. So that's what happened in the second last section of this partograph. So next we are moving on to the last section of the partograph. It include urine analysis. So which consisting of physical characteristics such as color, volume, pH, specific gravity, or the test for presence of acetone, or the glucose and protein we are testing. So these all are the things included in the last section, that's urine analysis. So that's all about the partograph. So by this partograph we can identify the deviation from any normal labor. Also we can identify the duration of first stage and early assessment of prolonged labor. So that's the purpose of this partograph. Okay, so that's all. Thank you for watching. If you are new to my channel, don't forget to subscribe my channel, and if you have any suggestion of the topic, you can comment and I will do that topic in my next video if you would like to know any other topics. Thank you.